Hi, everyone, and welcome to CE Institute. My name is Selena Belisle, and I'm the founder and one of the instructors here, where we usually provide paid CE certificate training to massage therapists, body workers, and cosmetologists. We also have lots of nurses, physical therapists, occupational therapists, and acupuncturists, and so forth in our classes, and everybody is welcome. Today, I wanted to quickly show you the signs and symptoms of a deep vein thrombosis, also known as a DVT. I'm going to take you to the CDC website real quick to give you the definition. And they wrote, deep vein thrombosis is a medical condition that occurs when a blood clot forms in a deep vein. These clots usually develop in the lower leg, thigh, or pelvis, but they can also occur in the arm. I do know a massage therapist who was massaging this client's arm pain for 3 consecutive days. And eventually the client went to the emergency room and they found that they had a DVT, which was really shocking and alarming. So everyone should know the signs and symptoms of a DVT. If you look at the right-hand leg here in this picture, which is the leg that's on the bottom half of the screen, you'll see that this leg is noticeably discolored and a little bit darker compared to the left leg in the upper half of the screen. That's because there is a blockage within the deep vein, and that blockage of circulation due to the thrombosis or blood clot is creating a collection of excess blood within this lower extremity, causing the discoloration. It's also causing swelling. Can you see how much larger the right leg is compared to the left? Okay, so there's redness. This client is probably in extreme pain. They might come to your massage office for a massage when they really have a DVT because they're in pain. And maybe you practice lymphatic drainage or something and you have it advertised, oh, I can relieve swelling. Well, in this case, with something like this, you see it, you feel it, it's hot to the touch. There's also other weird sensations that a client might experience, such as numbness or itching, but it's usually pain would be the number one thing they're feeling, and visibly seeing the redness and swelling are other indicators that this might be a DVT. Now, very important, I want to show you that on the CDC's website here, that this is a life-threatening condition, okay? If you read here, and I'm down on the third paragraph, it's important to note about DVT because it can happen to anybody and it can cause serious illness, disability, and in some cases, death. Okay. DVTs are preventable if they're discovered early, and you might play a role in that discovery if you do see a client in your office that's looking like this unilaterally, one leg or one arm is red, swollen, extreme pain, hot to touch, blood pooling in the extremity. There might be an obstruction of circulation due to a blood clot. Now, I want to show you there's a lot of information on the CDC website. It's cdc.gov, and they'll give you all types of information of prevention and treatment, more symptoms, and so forth. If you do see somebody who has a potential DVT, massage therapist, body workers, spa practitioners, we do not diagnose, but if you see this client needs to seek emergency care. It's not go home and go to bed and you can call your doctor in the morning. This is go to the emergency room before the DVT, the blood clot, releases and travels to the lungs and causes a pulmonary embolism. And that is right here in the complications of DVT. The most serious complication of DVT happens when a part of the clot breaks off and travels through the bloodstream to the lungs, causing a blockage called pulmonary embolism, also known as a PE. If the clot is small and with appropriate treatment, people can recover. However, there could be some damage to the lungs. And if the clot is large, it can stop blood from reaching the lungs and the patient usually dies. So we don't want somebody trying to drive themselves to the emergency room either. If that blood clot releases and they experience a pulmonary embolism on the way to the hospital, they might get in a car accident and kill others in addition to themselves. This isn't a 911 situation. Call maybe an ambulance if they see fit, maybe take an Uber, maybe arrange that their loved one drives them to the emergency room or some type of emergency medicine clinic, urgent care clinic. They need to get this treated, because if it's caught early, it usually is not fatal. If it's not caught or treated, this could be a fatal condition, and they should not be on your table trying to achieve pain relief. They actually need emergency medicine. So this is all I have for you about DVT today, but we do teach a lot more. So we do hope to see you in one of our other pre-recorded trainings, whether it's here in CE class or any of our videos on YouTube. We also teach live in-person training and live interactive webinars. We are at ceinstitute.com. That's CE as in continuing education. So ceinstitute.com. And until we see you in another class, be safe.